The drug industry is making record profits during a time when more patients are dying from their defective products. See the story at drugsafetynews.com.
Lawsuits are beginning to mount against the manufacturers of inferior vena cava filters, small devices implanted into patients to help catch blood clots. Now, the lawsuits claim that the devices might be causing more harm than good in patients, and I'm joined now by Howard Nations, who's working on behalf of plaintiffs in these cases. So, Howard, these inferior vena cava filters, IVC filters, have been implanted hundreds of thousands of patients throughout the United States. Give us the rundown on this. What exactly are these used for, and what are the problems that we're seeing?
Well, the purpose of the IVC filter is to catch a blood clot before it enters the lungs and potentially can cause a pulmonary embolism. The fact is that the design is so bad that they often create more problems than they stop. There are 200,000 implanted per year. It's about a $450 million a year industry. They use it when anticoagulation medication is contraindicated. So if they can't stop it with anticoagulation, they put these IVC filters in. But there's some very dangerous complications. The filter is implanted into the vena cava, which is the largest vein in the body. And that's a very dynamic environment of use. Between blood flow, diaphragmatic, and lung motion, it creates a very active area that interferes with the stability of the filter. And the filter itself, the designs vary. There are several of them on the market, but the recovery is a classic early design. It has 6 arms, 6 legs that have very sharp feet that attach to the interior surface of the actual vena cava vein itself. And they capture and hold the clots until they dissolve. The problems with the design, as Bard, one of the manufacturers, admitted in discovery, they failed to consider and to understand the environment of use when they designed it. The result is that it has 6 major failure modes. You have migration, which is a frequent cause of death. It's the most frequent cause of death in IVC filters. That's where the entire filter comes loose and moves in the vein. Perforation, which penetrates the vein itself and can penetrate adjoining organs, can penetrate the aorta, or they can become embedded so they can't be removed. They can tilt, which makes them, first of all, ineffective, but also it can lead to it being prothrombotic, which means that they're actually creating the problem they're trying to solve. They capture blood and they keep capturing it to the point where a clot forms at the IVC filter when it's not properly placed. And the latest study of IVC filters, which just came out, indicates that the failure to remove an IVC filter timely can result in untreated clots that increases the risk of post-thrombotic syndrome by 90%. It reduces blood flow by 45%, increases the risk of creating a pulmonary embolism by 30%, and causes venous ulceration by 15%. So it's turned out that they are, as I said, they can create a lot more problems than they ever solve. So the FDA has warned that you should remove it within 1 to 2 months after the initial implantation.
So before the FDA stepped in and said that they should be removed after 1 to 2 months, were these devices just meant to be placed inside of a patient and stay there? Or was there a timeline that they needed to be removed before that?
Well, they were originally designed as permanent filters to be left in place. Then they changed them to a retrievable filter to give you the option to take them out or leave them in, but they still ran into problems. One of the biggest single problems that they have is fracture. And let me give you an example of that because it illustrates the point you're making, which is this is where a part of the filter, usually a leg, breaks off and perforates organs or the spine. In a case that I currently have pending, a nurse fell. She got a knee injury, which caused the threat of a DVT, deep vein thrombosis, forming in her calf and moving up to form a pulmonary embolism. Since she was immobilized, they put in an IVC filter in 2009. They left it in as a safety feature. The doctor said, well, you may as well just leave it in because you'll have an additional safety figure to guard against clots. 6 years later, she's on a plane on a cross-country flight. She has chest pain. When she lands, they rush her to the hospital. She's experiencing severe loss of blood. They do a CAT scan. They find that the leg is missing from the filter. They put her into open heart surgery. She's lost 1 complete unit of blood, which they suction from the pericardial sac. They can't find the fracture, the little leg that's missing. The doctor takes the heart in his hands and finally lifts it and finds that the little metal leg is perforated. It's right there in the pericardium where it's causing a constant blood leak. They located it just in time to save her life. 6 days later, they go back in and remove the IVC, the complete filter. When they do so, they find that another leg is still missing, and that's still true today. She still has that other leg somewhere in her body. And since the first one almost killed her, she worries daily as to when she'll discover and how she'll discover this one. Now, the warning about this is so many of these were put in 2010 and 2011, 2012. The fracture rate is at an average of 5.5 years. She had had hers in for 6 years, no problem whatsoever until the day it almost killed her. So there are hundreds of thousands that are still implanted that are coming up on that 5.5-year fracture rate right now.
And so these little devices, and we've shown the picture here, but when they fracture, it can send these little legs throughout the body, and they're almost like little, I guess you'd call them missiles or little bullets that are going through the bloodstream, just waiting until they hit something, a wall, a tissue of a vein or the heart, and they just poke the hole in it. Right. And so at that point, how do the doctors find these? I mean, you're literally talking about a needle in a human body that is so tiny, almost you can't see it. So how do they find them when they fracture, when they break, or when they migrate? I mean, this seems like an almost impossible search.
Well, depending on the location, they can show up on CAT scan. We've seen them. They show up like a little neon light on CAT scans in certain locations. In other cases, such as in the pericardium, they find them only when they're causing blood flow. They're tracking loss of blood, and they track the blood flow back to find the source, and that's how they find them. That's a hard way to find them because you may or may not find them in time. The risk that people have with this, though, is that you discover this fracture, the migration, the tilting, the perforation, or the clot formation on CAT scan. That's how you find them. But sometimes severe pain is not recognized. They have internal bleeding, they have severe pain, but doctors don't recognize the vena cava filter